Hello, this will be a short case presentation on a dog with a portosystemic shunt. He is a 2-year-old male Shih Tzu with a history of occasional episodes of disorientation and confusion. Low albumin was found on his blood work. For these reasons, we were suspicious of a portosystemic shunt. So, clinical signs that cause suspicion of a portosystemic shunt include small stature, encephalopathy, vomiting, and urinary signs such as stranguria. Ultrasonographic signs that lead us to look for a portosystemic shunt include small liver, large kidneys, urinary calculi, or nephrolithiasis. The urinary calculi will not be seen on radiographs because they are urate stones and will not exhibit the mineral opacity that most stones do. When all these signs are present, we are likely to find a portosystemic shunt. The next step is then to measure the portal vein and aorta diameters to obtain a ratio. The portal vein to aorta ratio is an important step in further evaluating for a portosystemic shunt in dogs or cats. This is performed at the level of the porta hepatis, which is seen in the top left corner of the image. Ideally, a transverse image would be acquired. However, we're not always able to obtain this view either due to gas within the gastrointestinal tract or the conformation of the patient, such as in boxers. So this would be an example of how the probe is oriented to obtain this transverse view with the portal vein, caudal vena cava, and aorta. And here would be the corresponding ultrasound image, where again we have the portal vein, caudal vena cava, and aorta. If we can't acquire this view, we will perform the measurements in a longitudinal view. So the probe will be oriented parallel with the vessels. So instead of cutting across, it's going to be oriented more along the axis of the vessel, either the caudal vena cava, portal vein, or aorta. A portal vein to aorta ratio of less than 0.65 supports an extrahepatic portosystemic shunt or idiopathic non-cirrhotic portal hypertension. Dogs and cats with portal vein to aorta and portal vein to caudal vena cava ratios of greater than 0.8 and greater than 0.75 respectively do not have an extrahepatic portosystemic shunt. It is important to acquire the portal vein measurements cranial to the shunting vessel, as we will see in the video what can happen if we hadn't done that. The video will first start with the left kidney. Within the left kidney, we see hyperechoic foci along the renal diverticulae here that exhibit distal acoustic shadowing, and these are compatible with mineral sediment. We'll move to the urinary bladder, where we see multiple small, round, coalescing hyperechoic foci, again with acoustic shadowing, and these are compatible with cystic calculi. Moving on to the right kidney, we'll see similar mineral foci along the renal diverticulae. And neither of these kidneys were big on ultrasound. So from here we'll move to the liver, and if you look at the bottom left part of the video here in just a second, you'll see that the ultrasonographer will place his finger on the xiphoid process just to give you an idea of how far into the costal arch this liver is, and that it's rather small. So from here we're going to move on to the right kidney briefly, just push towards midline, and we'll see the aorta more dorsally, and then the caudal vena cava more ventrally. And you can see that the caudal vena cava is subjectively enlarged compared to the aorta. Multiple things can affect that, such as pressure from the ultrasonographer or patient breathing. From there we're going to move closer to midline, and we will see the portal vein just in a second. So the portal vein is actually going to be coming in and out of view. It's going to be this vessel here, and we'll give a still image in just a second so you can see that better. You can see that sometimes some gas from the stomach is coming in and shadowing, inhibiting some of the image of that. So there we have a nice image of the portal vein, and we'll take a measurement where you can see this will be about 0.22 centimeters in diameter. From here we're going to follow the portal vein caudally, and as we do that you're going to notice that the portal vein will get a little bit bigger. So here's the portal vein, and you can see subjectively that that is larger than what we had seen cranially. Also, you can see this anomalous vessel here, leaving the portal vein there, and we will turn the color flow Doppler on here in just a second there. And most vessels that are going towards the portal vein should be red, whereas this one is blue, meaning it's leaving the portal vein. We also saw a little bit of turbulence, but not much. This is a large shunting vessel, and it's kind of coursing in a sigmoid pattern there, and then here's the caudal vena cava right there. And we'll see that just in a second. There's the vessel right here that's leaving the caudal vena cava. And just to kind of give you an idea of what it's doing, we have the caudal vena cava here, and it's kind of going in a sigmoid pattern back to the portal vein. So again, just kind of keep that in mind as we watch this for the few next seconds. Portal vein there, caudal vena cava there. So this is a good example of how the portal vein gets larger caudal to the shunting vessel. So again, caudal vena cava, we have that shunting vessel coming off there, and there's the portal vein. It's caudally. So the portal vein to aorta ratio in this dog was approximately 0.31, which is significantly less than the normal of 0.65. The dog returned to the referring specialty clinic for surgical correction of this large portocaval shunting vessel. If you guys have any questions about this video or portosystemic shunts in general, either talk to the resident who's on ultrasound this week or the faculty who's on. Hope you enjoyed, and that's the end.